Hello everyone, I am Dr. Deepa. Today we are here to learn about the topic the nasal septum. The nasal septum is the partition which separates the entire nasal cavity into two halves, the right and the left. This nasal septum is covered by the mucous membrane except the anteriormost part which is mobile. This part of the nasal septum is covered by the skin. The septum as such is formed partly by the bones and partly by the cartilage. As we can see in this view, the sagittal view showing the nasal septum here. So the nasal septum, which is roughly quadrilateral in shape, which is limited, which has got the anterior boundary, the posterior, the upper and the lower margin. In the lowermost part, the nasal septum is in contact with the palate, the hard palate, which separates the nasal from the oral cavity below. This nasal septum, as we can see, is covered by the pinkish mucous membrane. Moving on to the bony parts or the formation of the nasal septum. When we talk about the formation of this nasal septum, as I have already told, the nasal septum has got the bony component as well as the cartilaginous part. So the bones which take part in formation of the nasal septum are, in this view, in this picture, we can make out the bones which take part in the formation of the nasal septum, which is been represented in different colors. There are two bones which take part in forming the nasal septum. Along with the two main bones, or called as the principal bone, we have the accessory minor bones as well. So the bones taking part in the formation of the nasal septum, that is the principal bones, the principal or the main bones which take part in the formation of the nasal septum are, number one is the perpendicular plate of the ethmoid bone. The very first is the perpendicular plate of the ethmoid bone. Second is the vomer. So these are the two principal bones which take part in the formation of the nasal septum. As we can see in this picture, the posterior part of the nasal septum is mainly bony and the anterior part is cartilaginous in nature. So the two principal bones include the perpendicular plate of the ethmoid and the vomer. The perpendicular plate of the ethmoid bone and the vomer. Regarding the upper bone, that is the perpendicular plate of the ethmoid, this perpendicular plate of the ethmoid makes up the anterosuperior part of the nasal septum. It makes up the anterosuperior part of the nasal septum, and this bone articulates with the following bones around it. So anteriorly, the perpendicular plate is seen to articulate with the nasal bone as well as the nasal spine of the frontal bone. Superiorly, it is seen to articulate with the cribriform plate of the ethmoid. Below, it is seen to articulate with the part of the vomer, and anteriorly it is seen to be in contact with the septal cartilage. In the posteriormost part, the perpendicular plate of the ethmoidal bone is seen to articulate with the part of the sphenoidal bone, here, which is called as the sphenoidal crust. This is called as the sphenoidal crust or the crust of the sphenoid bone. So this is about the margins of the ethmoid, that is the perpendicular plate of the ethmoid. Moving on to the second principal bone, that is the vomer. This vomer is seen to articulate above with the perpendicular plate of the ethmoid as seen here. In the lower part, the septal cartilage. behind, that is the posterior margin of this vomer, is free, as we can see here. In the lower margin, the vomer is seen to articulate with the nasal crest of the maxillary as well as the palatine bone, as seen here. So this is about the vomer. Moving on to the accessory bones or the additional bones which contribute to the formation of the nasal septum. There are accessory bones like that of the nasal bone in front, like that of the nasal bone in front here, as we can see. Just above the nasal bone, we can make out the nasal spine of the frontal bone. So there is nasal bone, the nasal spine of the frontal bone, which is seen to articulate with the perpendicular plate of the ethmoid. Other than these two anterior bones, we can also make out the nasal crest of the maxillary bone as well as the palatine bones. In the posterior part, the accessory bones are contributed by the sphenoidal crest and also the lower part of the sphenoid, which articulates with the vomer. This part of the sphenoid, which is seen to articulate with the vomer, is called as the sphenoidal rostrum. It is called as the sphenoidal rostrum, or simply the rostrum of the sphenoid. So all these make up the accessory bones. So the accessory bones include, number one is the nasal bone, then next comes the nasal spine of the frontal bone, next is the parts of the sphenoid, that is the sphenoidal crest, the sphenoidal rostrum, and from below it is the nasal crest of the maxillary and the palatine bones. So all these bones make up the accessory bones of the nasal septum. So the main bones are two, that is the perpendicular plate of the ethmoid and the perpendicular plate of the ethmoid and the vomer here. So this is about the formation of the bony formation of the nasal septum. Moving on to the cartilaginous part of the nasal septum. As we can see over here, the cartilaginous part of the nasal septum is mainly formed. It is mainly formed by the septal cartilage, as we can see. This is the diagrammatic view of the formation of the nasal septum, as it is made up of the bones and the cartilage. When we talk about the cartilaginous part of the nasal septum, the antero-inferior part of the nasal septum is mainly cartilaginous in nature, and the cartilages which take part in the formation of the nasal septum are, as I said, the septal cartilage mainly. It is the septal cartilage mainly. Other than the septal cartilage, we can make out the small, in the anterior most part, we can make out the septal process of the lower nasal cartilage or the alar cartilage. The septal processes of the alar cartilage as seen here. So these are the bones, these are the cartilages which take part in formation of the nasal septum anteriorly. So other than these two cartilage, that is the septal cartilage and the alar cartilages, there may be the presence of one cartilage which is called the vomeronasal cartilage. Sometimes there is a presence of the vomeronasal cartilage. The vomeronasal cartilage, if present, it is seen to intervene between the septal cartilage and the vomer bone, as we can see here, as I'm trying to show the there is sometimes is a presence of the cartilage which is called as the vomeronasal cartilage. So this cartilage is called as the vomeronasal cartilage. So if present, this cartilage is seen between the vomer and the septal cartilage. This cartilage contains the mucosal pouch which is lined by the olfactory epithelium. The importance of this vomeronasal cartilage is that it the mucosal pouch which is seen within it is lined by the olfactory. It is lined by the olfactory epithelium. It is lined by the olfactory epithelium and also contains the olfactory nerves. It also contains the olfactory nerves. So this is the importance of the vomeronasal cartilage. So this vomeronasal cartilage contains the mucosal pouch which is lined by the olfactory epithelium, as well as it contains the olfactory nerves. This area is called as the vomeronasal organ. So the mucosal pouch which is seen within this piece of cartilage is called as the vomeronasal organ. So they are called as vomeronasal organ of Jacobson's. It is named as the vomeronasal organ of Jacobson. So this nasal organ, this vomeronasal organ is rudimentary in case of man, but it is prominently developed, it is well developed in case of macroscopic animals like that of the rabbits and dog. So these vomeronasal organs are well developed in case of animals like the rabbits and the dogs. So this organ is called as the vomeronasal organ of Jacobson. So this is about the formation of the nasal septum as a whole. Next, moving on to the arterial supply of the nasal septum. The arteries which take part in supplying the nasal septum, that is in the anterosuperior part. In the anterosuperior part, the arterial supply is by the anterior ethmoidal artery, which are the branch of the ophthalmic artery. From the inferior part, the arterial supply is by the labial branches of the facial artery, whereas the posterior part of the septum here are supplied by the sphenopalatine and the greater palatine arteries. In the posterior part, the arterial supply is mainly by the sphenopalatine and the greater palatine. These two are the branches coming from the maxillary artery. So this is about the arterial supply of the nasal septum. One important thing which needs to be mentioned here is the presence of the Little's area, which is seen in, this is the area present in the antero-inferior part of the nasal septum. This is the area seen along the antero-inferior part of the nasal septum. This area is highly vascular. It is highly vascular. So in this area there is the anastomosis of the arteries seen, that is where the septal branch of the facial. So there is anastomosis of the septal branch of the facial, the anastomosis between the branches of that is the terminal branches of the greater palatine and the sphenopalatine arteries take place. So the branches of the greater palatine, the sphenopalatine artery and the labial branch of the facial artery tend to anastomose at this antero-inferior part, which becomes highly vascular, and this area of anastomosis is called as the Little's area. The plexus of the vessel seen here is called as the Kiesselbach'S plexus. It is called as the Kiesselbach'S plexus. So the plexus of the arteries which is formed here has got the name Kiesselbach'S plexus. So this is about the Little's area. So this is about the Little's area. This area is important because any small ulcer or injury in this area affecting this area produces profuse arterial hemorrhage. So this is the clinical importance of the Kiesselbach'S plexus or Little's area. So this area acts as the site of epistaxis. So this area acts as the important site of the epistaxis or the nasal bleeding. So this is about the arterial supply. Moving on to the venous drainage of the nasal septum. The veins of the nasal septum is mainly through they accompany the arteries itself, that is the anterior, the superior ophthalmic veins, the pterygoid venous plexus from the posterior inferior part, as well as from the mobile part of the nasal septum. The venous drainage is through the facial veins which end up in the jugular vein, that is the internal jugular vein. From the upper part of the nasal septum, the veins accompany the olfactory nerves and they are seen to drain into the internal inferior cerebral veins. From the uppermost part of the nasal septum, the venous blood drains into the inferior cerebral veins. So this is about the blood supply. Moving on to the nerve supply of the nasal septum. The nerve supply of the nasal septum, that is, there is a olfactory zone along the roof of the nasal septum which is supplied by the bundle of the olfactory nerves. There are around 15 to 20 olfactory nerves. There are around 15 to 20 olfactory nerves which leave the nasal cavity by passing through the cribriform plate of the ethmoidal bone, as we can see by passing through the cribriform plate of the ethmoidal bone. These olfactory nerves convey the sense of smell from the central processes of bipolar olfactory cell. So they carry the sense of smell through this olfactory zone. So this is about the sensory. The remaining zone is completely supplied by the general nerves, that is the anteroinferior part of the nasal septum is supplied by the ophthalmic and the maxillary divisions of the trigeminal nerve. We can see the branches which include the anterior ethmoidal nerves and the anterior superior alveolar nerves. In the posterior part, the branches are the pterygopalatine ganglion. So the branches coming from the pterygopalatine ganglion, which include the nasopalatine and the posterior superior nasal branches. So the branches of this ganglion supply the almost the posterior part of the nasal septum. So this is about the nerve supply. Moving on to the lymphatic drainage of the nasal septum. From the anterior part, as we can see, the anterior part of the nasal septum drains into the submandibular group of lymph nodes. We can see here the anterior part drains into the submandibular group of lymph nodes, whereas the posterior, from the intermediate and the posterior part, the lymphatics reach the retropharyngeal group of lymph nodes. From the intermediate and the posterior part of the nasal septum, the lymphatics tend to reach the retropharyngeal group of lymph nodes. So this is about the lymphatics. From the roof of the nasal septum, few lymphatics from here, that is from the roof of the nasal septum, accompany the olfactory nerves along the perineural sheath and they are seen to drain into the CSF of the subarachnoid space. So this is about the lymphatic drainage of the nasal septum. So this is all about the nasal septum. So in this video we have studied about the formation of the nasal septum, the bones and the cartilages taking part, the blood supply, the nerve supply, the lymphatic drainage, and the important clinical aspect about the epistaxis and the littles area. Thank you.